What if I told you that your brain already knows how to heal itself? What if the key to overcoming trauma isn't about forgetting, but about remembering differently? For millions of people, from veterans haunted by combat to survivors of profound personal loss, this isn't just a philosophical question, it's a life-changing reality. Welcome to the Brain Talk Sessions YouTube channel. Your journey to a healthier mind starts here, where we share psychology explained for everyday life. Today, we're exploring EMDR, a mysterious but powerful, science-backed therapy that is revolutionizing how we treat trauma. It all started with a walk in the park by Dr. Francine Shapiro, and what she discovered would go on to change countless lives. So, what exactly is EMDR? The name, eye movement desensitization and reprocessing, sounds complex, but the core idea is beautifully simple. Imagine a traumatic memory is like a record stuck on repeat in your mind, playing the same painful moment over and over, keeping the distress alive. EMDR helps the needle move forward, allowing the brain to finally process and store the memory correctly. It's used to treat a wide range of conditions that people identify with every day, like PTSD, crippling anxiety, phobias, and deep-seated grief. The therapy uses what's known as bilateral stimulation, which can be guided eye movements, alternating taps on your hands, or sounds played in each ear, to activate the brain's natural healing mechanisms. By making this complex topic clear from the start, we build trust and create a foundation for understanding its profound impact. To truly grasp why EMDR is so effective, we need to look at the science. When you experience a traumatic event, your brain's alarm system, the amygdala, goes into overdrive. Meanwhile, the hippocampus, which is responsible for organizing memories, can get overwhelmed and shut down. This is why traumatic memories often feel fragmented, intrusive, and stuck in the present. They haven't been properly filed away as in the past. Animations of neural networks and even brain scans show a remarkable difference before and after EMDR. We can visually see the overactive amygdala calm down and the brain's communication pathways re-engage. Key scientific studies have repeatedly validated EMDR's effectiveness, showing results for PTSD and depression that are often faster and more durable than traditional talk therapy. While the data is compelling, the approach remains deeply human-centered, focusing on the individual's unique journey to healing. With all this science, you might be wondering, what actually happens in a therapy room? Let's demystify the process by walking through what an EMDR session looks like. It's a structured, 8-phase journey guided by a trained professional. It's not about being forced to relive your trauma. Instead, it begins with building a strong foundation of trust and safety with your therapist. You'll learn coping skills to manage distress before ever addressing the traumatic memory. During the processing phases, you'll be asked to briefly hold the memory in mind while engaging in bilateral stimulation, like following the therapist's fingers with your eyes. The therapist is there every step of the way, ensuring you feel grounded and in control. The atmosphere is calm, gentle, and professional. This structured approach reassures people that EMDR is a safe, methodical, and non-invasive process designed to empower them, not overwhelm them. Theory and science are one thing, but the true power of EMDR is seen in the lives it has transformed. Let's move from the clinical to the personal with real stories of transformation. Picture a combat veteran who, for years, was tormented by flashbacks, unable to escape the sounds and sights of war. After EMDR, he can now recall his service with a sense of peace, the memories no longer controlling his present. Or consider a survivor of childhood abuse who carried the weight of shame and fear for decades. Through EMDR, she was able to reprocess those painful events, finally internalizing the truth that she was not to blame, freeing herself to build a future defined by hope, not hurt. These are not stories of sensational miracles, they are testaments to the brain's incredible capacity to heal when given the right tools. The shift is profound, the trauma becomes a part of their story, but it no longer defines their entire existence. So, why does this process work on a neurological level? A leading theory compares the bilateral stimulation in EMDR to the rapid eye movements we experience during REM sleep. REM sleep is the brain's natural, nightly self-healing phase, where it processes the day's events, sorts information, and consolidates memories. EMDR seems to tap into the same powerful mechanism while you are fully awake and conscious. The back-and-forth stimulation helps synchronize the brain's left and right hemispheres, connecting the logical, analytical left brain with the emotional, intuitive right brain. This integration allows the stuck, traumatic memory to be properly processed and stored. It's like updating a corrupted computer file. The information is still there, but it's no longer disruptive. This is why new research is exploring EMDR's potential for treating a wider range of issues, including addiction, chronic pain, and performance anxiety. Naturally, a therapy this powerful has been met with skepticism and misconceptions. Let's address some of the most common myths. Is it a form of hypnosis? No. In EMDR, you are fully awake, conscious, and in control the entire time. You are an active participant in your own healing, not a passive recipient. Does it erase memories? Absolutely not. EMDR doesn't make you forget what happened. Instead, it desensitizes the emotional charge of the memory, so you can remember it without being re-traumatized. It changes how you remember. By addressing these objections directly, we can see that EMDR isn't a mystical quick fix, it's a methodical, evidence-based psychotherapy grounded in neuroscience. This isn't just a niche therapy. EMDR has earned global recognition from the world's leading health organizations. The World Health Organization, WHO, the American Psychiatric Association, APA, and the UK's National Health Service, NHS, all recommend EMDR as an effective treatment for PTSD. There are now more than 100,000 trained EMDR therapists in over 130 countries. Its power has been demonstrated not just in private clinics, but on the front lines of humanitarian crises, helping survivors in disaster zones and refugee camps begin the process of healing. This worldwide validation reinforces that EMDR is a credible, respected, and powerful tool in the global effort to address trauma and promote mental well-being. If this has inspired you, you might be wondering how to access EMDR therapy for yourself or a loved one. The most important step is to find a certified EMDR therapist. You can use official directories from organizations like the EMDR International Association, EMDRIA, to find qualified professionals in your area. Many therapists now offer both in-person and online sessions, increasing accessibility for people everywhere. In your first session, you can expect to discuss your history and goals with the therapist to determine if EMDR is the right fit for you. It's just crucial to remember that EMDR is a professional therapy and should never be attempted as a self-administered technique. Healing from trauma requires the guidance, safety, and expertise of a trained clinician. As we conclude, let's return to the core idea. Healing is not about erasing the past, because our experiences, both good and bad, make us who we are. The goal of EMDR is not to forget, it is to remember with peace. It helps you take a memory that has been dictating your life and put it back in its proper place, as a part of your history, not a defining force in your present. The power to heal is already within you, and therapies like EMDR can help you unlock it. Would you ever consider trying EMDR therapy? Let us know in the comments below. If you found this information valuable, please share this video to help raise awareness about trauma recovery. And for more deep dives into psychology and neuroscience, make sure you subscribe to our channel. Your journey to a healthier mind starts now.